the Act, which you can see on the really do underpin the quality of experiences and opportunities that children receive each and every day. The Health and Care Staffing Scotland Act has a focus on valuing and appreciating staff, and we want to support and guide you through this legislation today. And across our webinar series, really highlight good practice already happening within the sector and celebrating the people working in the ELC around Scotland. We'll start with an overview of the Act as a whole. There are 4 parts to the Act, which you can see on the screen. The first part affects the work of all services registered with the Care Inspectorate. These are the guiding principles, which I'll cover this morning. The second part is only applicable to services in the NHS, so do not apply to services that you provide or that we regulate. The third part is applicable to care services again, and this is where we see the similarities with the current legislation of Regulation 15, which we'll cover today. Chapter 3A within Part 3 is only applicable to services using a staffing method framework, which at the moment are care home services for adults. There is a caveat in the legislation that Scottish ministers may introduce this in other sectors in the future. However, the Scottish ministers have not requested we introduce this in the ELC sector at this time. Part 4 is a short part of the Act and identifies the ancillary provision, which really provides for the commencement of the Act. So this part of the Act does not hold any expectations from services. We can see here that although the legislation contains much more detail than the current legislation in relation to staffing, that of Regulation 15, there are only some parts of the Act applicable to the ELC sector, so our webinar series will focus on Part 1 and the first section of Part 3 of the Act. Before we move on to the parts of the Act that are applicable to ELC, we just wanted to show you the image for the staffing method framework that's mentioned under Chapter 3A of Part 3. Again, this is not applicable for us, but if you log on to our hub page or if you see any information online about the Act, you will likely see this image because this is quite a big change for the adult care home sector. So we felt it was better to show you the image to know that it doesn't apply to ELC at the moment. There are some really good elements in this framework that we find we're already using in ELC, but the use of this framework is not currently expected or mandated from April. So moving on to Part 1 of the Act, and this part tells us about the guiding principles. These apply to all social care services. So the Act states, the main purposes of staffing for health and care services are to provide safe and high quality services and to ensure the best care outcomes for people who use services. The rest of the Act is all about making these main purposes happen. Services should be able to discuss how you've considered the guiding principles and use them when making decisions about staffing. Staff should also be supported to understand the main principles of the legislation, as this is what underpins their practice. So all services need to be aware of what the new legislation entails and consider how you will ensure that you meet the expectations of the Act. So when you're considering staffing in your service, the main purpose of staff should be to provide safe and high quality services and to ensure the best care outcomes for children. In order to achieve this, we need to consider 8 principles of the Act. Those 8 principles are on the slide now and feature in Part 1B of the Act. These are referred to as the main principles and must be considered when arranging staffing in any service type in order to achieve the 2 guiding principles that were set out in the last slide.